Thank you for joining the First Unitarian Universalist Church of Houston for our weekly online ministers forum. I'm the Reverend Dr. Colin. Okay, I got to start that over. Thank you for joining the First Unitarian Universalist Church of Houston for our weekly online ministers forum. I'm the Reverend Dr. Colin Bossen, Senior Minister of the Congregation. These programs are conversations with community organizers, scholars, religious leaders, artists, and others about how we can collectively address the present crises. Their purpose is to offer members of our community and all who wish to join us online science-based resources and liberation-oriented inspiration to get through these difficult times. Today I'm joined by Dr. Michael Crouch. Dr. Crouch is a family physician. We'll be talking about recent developments with the COVID vaccines. Dr. Crouch has an MD from Stanford Medical School and a master's in public health from the University of Missouri. He's also a member of the board of the First Unitarian Universalist Church of Houston. Michael, thanks for joining us today.
You're very welcome. Happy to be here.
So I think if we could just kind of jump right in and you could start talking to us a little bit about, there's a bunch of different vaccines that are either in development or actually being distributed right now. So what are the pros and cons of the sort of four major ones, the Pfizer, Moderna, AstraZeneca, and Johnson & Johnson vaccines?
Okay, the two that are approved in the United States so far are Moderna and Pfizer. They share the advantage of being highly effective in elderly people, slightly less effective in elderly people, but highly effective still at about 90%, and overall about 95% effective. So they share that advantage. The Pfizer vaccine has the disadvantage of requiring ultra cold storage, about 190 degrees below zero. So it's requires like dry ice storage basically. And so it's more problematic for rural areas and pharmacies, doctor's offices, that kind of thing. The Moderna vaccine has the advantage of not requiring as cold a storage. Refrigeration needs are slightly below home freezer temperatures and easily met by pharmacies and hospitals and so forth. So that's the reason the distribution of the vaccines has been somewhat different so far. A major disadvantage of both vaccines is that they require two injections 3 to 4 weeks apart. The Johnson & Johnson vaccine, which is likely to be approved if their results are comparable to the previous two, it's likely to be approved within a few weeks and then distributed shortly after that, beginning distribution. If it's as effective, it has the major advantage of being a single injection. So that will improve compliance with people getting what they're supposed to get. The disadvantage of two injection immunization is that if you only get the first shot and don't get the second one, you're less well protected. How much less well protected is a little bit unclear still, but substantially less well protected if you only get the first shot and don't get the second. The AstraZeneca vaccine, the fourth one that's been developed, had some serious problems with their methodology. They made some mistakes early on and gave half the intended dose to a few thousand people. And then when they analyzed the results, those people, for some reason, appeared to be protected better, but they were more the young people, and they're better protected than the older people anyway. So their results are messy, and they're doing another large study now to try to gather enough data to get approval in the United States. Britain, as most people know, already approved the AstraZeneca vaccine because they were desperate to get something rolling. So we don't know how well it protects. It looks substantially less effective than Moderna and Pfizer. And Moderna and Pfizer both share the RNA vehicle for delivery, which is different from the other two, which have a virus delivery mechanism.
Right, and the RNA is a relatively new technology, correct? Whereas the virus is a more established one.
Yes, this is the first time a vaccine has successfully been developed and put into practice using the RNA methodology.
So, I think it might be helpful to talk a little bit about vaccine safety, because that's a thing that comes up in conversations that a lot of people have hesitancy around the safety of the vaccines. So, I wonder if you could talk to us a little bit about kind of, you mentioned the word trial. So how are these tested to ensure their safety? And in general, how safe do you think that they are?
Well, in the two trials that have gotten FDA approval so far, there are about 90,000 total patients, and there were very, very few serious events on the order of rare, basically anaphylaxis, that kind of reaction, very, very few. Now that we're rolling it out to millions of people, the incidence of serious adverse reaction, which has so far been limited to anaphylactic reaction, allergic reaction, basically causing the airway to close down, have occurred also rarely. There are a few cases in the United States, a few cases in England, and a few cases in South America. So overall, as vaccines go, both vaccines that have been approved so far are extremely safe. We don't know about what the safety will be with AstraZeneca or Johnson & Johnson, but so far, serious events rare. Minor reactions, including arm soreness. I got my first Moderna vaccine almost 4 weeks ago, and I'll get my next one tomorrow. I had a tender, slightly swollen biceps muscle, the whole muscle, not just where the shot went in, for about 3 days. And it didn't hurt while I was just sitting, but it was pretty tender when I pressed on it. But it was no big deal. I had no fever, no overall aches, or no other symptoms. The reports so far are that after the second injection, you're more likely to get a minor flu syndrome for about 24 hours with general achiness, not just in the area of the vaccine administration, and that you may have a fever as well, but only lasting a day or less typically. So those reactions, I'm not clear on what percentage. We don't have any reported aggregated data yet on the incidence of mild, moderate, and severe. The severe reactions are rare, we know that so far. And the mild reactions are fairly common, but no big deal. So they look very safe.
And my understanding, I have not been able to get a vaccine myself, but one of the things I understand is that they actually have the vaccine distribution set up in such a way as to sort of account for the possibility of anaphylactic shock by having people wait, 15 minutes after they get the vaccine before they can leave? Is that correct?
They routinely ask people to wait 15 minutes if you have a history of previous serious allergic reactions, such as to shellfish, like a lot of people have shellfish or seafood allergy, or you have bee sting allergy where you've gone into had anaphylaxis or hives or severe swelling. Anybody who has a serious allergic reaction history is asked to wait 30 minutes or in some cases an hour, depending on the severity of the previous reaction. And they have standing by the medication to administer, mainly epinephrine and other adjunctive treatments in case someone has a serious adverse reaction.
Right. So I think that that's important to understand just for people if, there is a possibility that you're afraid of having a reaction. Built into the whole way the vaccine is being distributed is this sort of safety precaution that doctors and the people overseeing the vaccinations have sort of made sure to put in place.
One of our congregants, at the Thoreau campus, had a serious seafood, and she's allergic to a bunch of other stuff too. She's had a number of emergency room visits over the years for this, and she was leery of getting the vaccination, but after talking with her immunologist and her asthma doctor, they advised her to go ahead and get it because she was more at risk for having bad complications of COVID than she was a serious reaction that couldn't be treated immediately and taken care of from the vaccine.
Well, I think that that's really important. And I think you're going to talk a little bit now, or you wanted to talk a little bit now after talking about sort of the vaccine process of how does the vaccine prevent you from becoming infected with the COVID-19 virus?
By the way, she got the first injection and did fine with it. So.
Oh, okay, good. I didn't know whether yeah.
She overcame her leeriness and did what she thought was the best thing. So repeat your question, please. I was thinking about, I wanted to make that point.
How does the COVID vaccine prevent someone from getting infected with the COVID-19 virus?
Okay, it doesn't. Maybe. It doesn't prevent you from getting infected. It prevents you from becoming seriously ill or dying from it most of the time. doesn't always, but it gives you a much, much, much better chance of having an asymptomatic or only mild case of COVID compared to a more serious hospitalization, ICU, ventilator, all that, or possibly dying from it. We don't know yet how well it's going to prevent you from becoming clinically infected, meaning a positive PCR COVID-19 test, because they didn't gather data on that. Neither Pfizer nor Moderna tested people to see if they had asymptomatic infection. They just had them contact the research people if they became symptomatic, and then they got tested. So their goal was to show they could prevent serious illness and death, and their goal was not to show they could prevent you from becoming infected at all. So the implication of that is you can get the vaccination, get both shots, have a good high level antibody level, and still be in contact with COVID. If you get sloppy and don't wear your mask and you're around someone with COVID, you may well still be able to get COVID infection, and then your immune system gears up quickly enough that you don't get very sick. But you might be, we don't know this, you might be contagious during that period of time that your immune system is fighting off the COVID virus.
So is that one of the big questions sort of out there in terms of like how fast people can get back to something that resembles the before times, as to whether these vaccines actually sort of stop the virus cold in its tracks or simply stop the severe symptoms of the virus?
That's, as we said in the 1950s, the $64,000 question. Mm-hmm. Adjusting for inflation, it's the $64 million question now.
Uh-huh. I know we talked about, you gave an example of a member of our congregation who had some concerns and fortunately, went and got the vaccine and had no, it sounds like, adverse outcomes. But I know that there are people out there who are skeptical about vaccines. There's a growing movement in the United States of skepticism around vaccines in general. So how should people make decisions about whether or not, we could talk about the COVID vaccine in particular or vaccines in general, however you want to take that question, but how should people go about whether or not deciding to get the vaccine?
Let's keep it COVID specific. I think that your decision whether to get the vaccination or not for COVID should depend on how vulnerable you think you may be to getting a serious case or a life-threatening case of COVID. Mm-hmm. If you think that if you're my age, 74, that automatically makes you somewhat high risk. And I'm very healthy, 74. If I had diabetes or hypertension or was going through treatment for cancer, anything that weakened my immune system, I would be even more worried about my risk for COVID and would be more inclined to get the vaccine. That's point one. Mm-hmm. Second point is, although you may not feel that you're very vulnerable to getting real sick, and you know that you might get a mild case of it, but you're feeling confident that it'll only be mild, there's also the possibility of you transmitting it to loved ones, coworkers, people around you. And so, in my view, if you're being a responsible citizen, it's my obligation, even if I think I would probably do okay with it. Say I was 35 years mm-hmm. old and super healthy. Mm-hmm. I would get the immunization when I got a chance to anyway, because I would feel like it's my responsibility to help try to prevent the spread from person to person, particularly to vulnerable people like people in nursing homes. My wife is a high risk because of her medical conditions. Mm-hmm. So I'm being super careful in large measure to protect my wife from getting sick or even dying from it. So that's the second point is first point, your vulnerability. Second point, vulnerability of people that you come into contact with, and that your sort of responsibility for helping stem the spread of this. It's clear the vaccine is going to help stem the spread of it. We don't know how thoroughly it will do that. And we feel, the medical professionals still feel like it's important to keep wearing masks for everybody to try to help the vaccine suppress the viral spread as much as possible by also doing the distancing, wearing the mask and so forth. I think we're going to be advised to do that through at least the first half of 2021 and likely throughout 2021, depending on other events that occur that we'll talk about in a little bit about viral mutations and so forth.
I mean, I think I'm not alone in hoping that it's sooner rather than later. But I also think that one of the things that it's really made clear in your comments just right now made clear is the sort of ethical dimension of all of this. I mean, there is a that public health. I mean, for me, and I think for a lot of people, it's really clarified that public health is partially about ethical decisions that individuals make, whether or not to get a vaccine, whether or not to wear a mask, whether or not to practice rigorous hand washing. And I think that, I mean, just sort of as a religious community, especially a religious community that I think is oriented towards this world more than, the next world, has been one of the kind of important lessons, so to speak, of the pandemic. And I think it ties into this question of herd immunity, right? Which we talk about a lot. So
Yes.
I think I would love to hear you sort of just define, first of all, what is herd immunity, and then we could talk about how soon we're going to reach it. But first of all, what is it?
Okay, herd immunity is the phenomenon whereby if a high enough proportion of the population either gets the disease and develops natural immunity, or gets vaccinated and develops artificial, if you want to think of it that way, immunity, that the aggregate of those two, if it gets to be about 80%, the virus has such a hard time finding its next victim that it can't spread effectively. Mm-hmm. And so we talk about flattening the curve. Herd immunity would flatten the curve by making vulnerable hosts so scarce proportionally that the virus has a great deal of difficulty spreading from person to person. And so the 80% figure is, nobody knows exactly what it is for COVID. It's thought to be somewhere in that ballpark of 75, 85%. And so 80% is kind of talked about as kind of a guesstimate of what it's going to take to get the virus in check enough that we might get some return to a, maybe not a pre-COVID normal, but a whole lot better abnormal than we've been living with for the past almost year now.
Are there other viruses that we've reached herd immunity with in the past?
We have reached herd immunity with a lot of viruses through vaccination primarily. When I was a youngster in the 50s, we reached herd immunity for some diseases like measles, mumps, chickenpox, whooping cough through most of us getting it. Mm-hmm. And so that was not a great way. I had 4 or 5 childhood illnesses in the second grade. I wasn't in the school picture in the second grade because I was sick so much of that year. Uh-huh. So nowadays we've gotten to herd immunity for most of the infectious childhood diseases, primarily through immunization of a large proportion. Now, if more and more people choose not to vaccinate, that threatens the herd immunity status. And we've already had measles outbreaks, for example, mm-hmm. when we've lost herd immunity in geographic areas because too high a percentage of people chose not to vaccinate their children.
So I think that really highlights how important it is for people to make a decision to get vaccinated, and why there's sort of like this aggregate of people's actions really do determine how much we are impacted by these by the pandemic and the way sort of out of it. How quickly do you think it's possible that we might reach herd immunity for COVID-19?
My best optimistic guess is if we can. Just to update you on what's happening with immunization, mm-hmm. I just looked this up before we talked, and as of yesterday or today, we have delivered 44 million doses of COVID vaccine, but only 24 million of them, a little over half, have been administered. So part of that's where they're holding second doses for people like me who've gotten the first dose, but we've got to get on the stick and get these administered more effectively. There have been all kinds of problems with that people have heard about. In the world, there have been 68 million people immunized already, 24 million of which are in the United States. So we've immunized about a third of the people immunized in the world. We're immunizing about 1.25 million per day in the US and 3.5 million in the world. In Texas, however, we're medium penetration so far. 6% of the Texas population has been immunized. 1 out of 16.
And it sounds like about 8% nationally, if I'm hearing the numbers that you gave.
Yeah, 8% nationally. We're a little lower than the national average for vaccine penetration so far, especially in West Texas and North Texas, where their penetration has been poor there. It's been much better in Houston, San Antonio, Dallas, and Austin.
Is that because of those areas are primarily rural, and therefore there's some of these?
They got more vaccine.
Okay.
We got more vaccine here. They concentrated the deliveries on the places that had the cold storage facilities for the Pfizer vaccine, and then Moderna started reaching out more to the less urban areas, but that's still not getting to places like the hometown of 4,000 people that I grew up in Northeast Arkansas.
So it really does sound like one of the potential slowing factors in terms of how quickly we're going to reach herd immunity in the United States is the cold requirements for the Pfizer and Moderna vaccines.
Yes.
So in terms of...
oh, wait, I didn't finish answering your question.
Yeah.
Optimistically, if people get immunized at a better clip, and we can get half the people immunized, and about another third of the population will have had COVID within a few months, then we have a good prospect of, by the mid-year to fall, of reaching herd immunity and flatten the curve very effectively, assuming no virus mutations change that projection. But if we can get our immunization act in gear better, and people are going to continue to get it. So I think that the prospects are reasonable that by summer or fall we might reach herd immunity. I'm optimistic in that regard. A pessimistic look will be more like end of the year or early next year. And
it seems like a lot of this depends on kind of decisions that the federal government makes as much as anything else, from what I've been reading.
Yes.
I read recently, I think it was today, that there are people who are trying to urge the new Biden administration to ramp up to 2 million doses a day. So that would, I think, get us there sooner rather than later.
Right. Problem with that, supply isn't there yet. If Johnson & Johnson gets approved, and I'm hoping they will soon, that will help tremendously in getting up to that goal.
You just mentioned a moment ago mutations as a potential problem. So there are several mutations, we're hearing about right now. I think that the new administration just shut down all non-citizen travel from South Africa, or non-commercial travel. Actually, I can't remember exactly what, but they shut down a portion of travel from South Africa because there's a new variant of the virus there, and we've heard about a new variant of the virus in the UK. How is this going to affect both the pandemic and the vaccines? Well, the effect on the pandemic will be that it may help us reach herd immunity. Unfortunately, if more people, if it's more contagious, which it looks like it is, the UK variant that's starting to spread rapidly across the United States, that may help us get to herd immunity quicker if the vaccine is effective against this mutation, which it looks like it is. The problem with South African mutation is it involves multiple mutations in the spike protein, which may make it significantly less responsive, or even potentially non-responsive to the vaccines that have already been developed. So already Moderna and Pfizer are talking about developing a booster shot that will address any evolving viral susceptibility to the vaccine. Sort of like this is COVID vaccine 1, and they're developing the second generation of COVID vaccines, starting to develop already to respond to mutations in the spike protein, which is what the vaccines target. So could it end up being sort of like the flu vaccine, where you have to get a different one every year because the virus mutates? Unfortunately, that's, I'm afraid, likely. That would be a bummer, although hopefully we would be able to get things organized enough to the point where we would be able to deal with that and be back to the before times in some sense. Yes, I'm hoping that too, but time will tell. Time will tell. So, I think this directly relates to the subject. and your answer may now just be not no, but like, how long are we going to be wearing masks and socially distancing to deal with the pandemic?
At least until July and probably till January of 2022 at the earliest is my guess. I think it's between biomutants, mutations, and vaccine rollout difficulties. I think it would be unwise to abandon the mask wearing until at least 6 months or so from now, and probably more like close to a year from now. And I say that as someone who's as tired as anybody
Sure.
of wearing. I have to wear the mask all day
Sure.
till I get to my motel room where I stay at during the week when I'm working and seeing patients. And so I take it off during when I'm eating lunch, but I wear it from morning till back to the hotel room. So yeah, I'm tired of it too, but it's just a smart thing to do. And just parenthetically, my wife and I traveled to Taiwan to watch my daughter play in the World Games at Ultimate Frisbee and watch her win a gold medal, which we were just over the moon about.
Wow, congratulations. I didn't know about that.
It was one of the biggest thrills of my life watching that. And about 80-90% of the people there wore masks all the time because they'd had the previous SARS epidemic there, and they'd had the bird flu thing also. So I'm pretty certain they've been wearing a mask since 2005 or 6 for 15 years or so all the time.
Wow.
Most of the people there. So we may wind up. Oh, the other interesting thing is I've seen very few colds and no flu this year.
Oh, interesting.
In my office, I usually see a fair amount of flu and a whole bunch of colds. I think the mask wearing is preventing the transmission of common cold and flu better than it's preventing the transmission of COVID. It's preventing the transmission of COVID to some extent, but I think it's doing a great job with keeping the colds. The other thing is that people aren't around each other as much in groups to transmit the colds too. So it's not just the mask; it's also the social distancing that's having that effect.
Yeah.
But maybe we should be wearing masks every winter. Or should have been wearing masks every winter for years because a lot of people die from the flu every year.
Right. I mean, I think that that's a very good point. I mean, I think that the flu. I mean, the 1918 flu pandemic was, of course, the last big pandemic in the United States and killed hundreds of thousands of people. And they actually did wear masks, although I think fairly rudimentary masks in many cases back then in a lot of places. And there is a direct correlation between places that engaged in more mask wearing back then and had lower flu incidence.
Right, and the cities that shut down their economies quicker did way better. There was a huge argument by the business community to not shut down, and that prevailed. And we kept sending troops to Europe infected with the flu, dying on the way sometimes. I read a book about that called The Great Flu Epidemic, and it was appalling. The decisions that were made that cost millions of lives.
Well, unfortunately, we can draw too many direct parallels between that and today.
Yeah.
Yes. So
we won't go there. It's just too depressing.
We will not go there. That's not really the subject of this forum. And I think that we are closing in on the end of our time. So, Michael, I'm wondering if you have any sort of closing remarks or comments that you'd sort of like us to leave with.
Wear your mask. Wear an effective mask. They're talking about double masking now as being maybe more effective. And I haven't read up on that. I just heard an NPR story with some experts advising wearing a surgical mask and a cloth mask and saying that might be substantially more effective. I'll have to see if I can find some information on that because I don't know how science-based that is versus this person's opinion that's just kind of out there. It's hard enough to get people to wear one mask and people complain about feeling like they have trouble breathing. So I would encourage you to just sort of they've done studies showing that you're breathing just fine, although you don't feel like you are, and your oxygen content doesn't change at all wearing a cloth mask. So I encourage people to live with the discomfort for the common good and for your good, and hang in there. And maybe a year from now, we won't be wearing masks, and we'll be looking at this as the most terrible time in our lives that's finally mostly over.
Well, I really hope that that is the case. And I would like to thank everybody who tuned in to watch this conversation. And Michael, thank you. You've been a great guest today, and I found this conversation to be very informative and helpful, and I hope that our viewers will have as well.
You're very welcome. It was fun.
For those of you who are with us for the first time, let me say a few words about Unitarian Universalism. We're a religious tradition that celebrates the possibility of goodness within each human heart, the transformative power of love, and the clarifying force of reason. We believe we need not think alike to love alike. I'd like to thank our staff for making this video possible. It was produced by Christian Holmes. Alma Viscara assisted with the editing. We'll see you all online soon and in person as soon as we can gather again. Please remember that no matter how isolated you feel, we're all in this together.